Okay, Dovey, let's talk about the big question. What causes autism? A spectrum neurodevelopmental conditions, which means that we have a lot of people that are diagnosed somewhere on the spectrum, and they have different clinical representations of autism. They all fit into the criteria somehow, just enough to be considered having autism, ASD. That also means that there may be different biological processes that can cause somebody to have... Can you sit down? That's a little bit troublesome. No, sit down. Yeah. They can have different clinical representations of their biological processes that cause them to have communicational problems. They cause them to have rigid adherence to routine or specific special interests, and also special abilities. Some autistic people are very highly intelligent. Some of them have special abilities. The main point is that there are different possible biological processes that cause these behavioral clinical representations of the autism spectrum disorders. And then the question is, what causes these different conditions that can get somebody diagnosed with autism? So we do know that there are genetic factors that are already known to be connected with autism. So some of the autistic people that have done genetic testing will... No, sit down. We're doing a talkie video. Okay, and they will find a genetic factor that is known to be connected with autism. Some of them will have genetic findings that are suspected to be connected, and some of them will not get a positive result on their genetic testing. That being said, if you don't have a positive result on your genetic test, that might mean that we just don't know what on your genes has connection to autism. Okay, so we also know you can go in from the other side. No? Okay, back in the seat. Okay, bibu bibu. Besides genetics, there's also epigenetics, which is how genes react with each other. So we're talking about, okay, one gene is okay on its own in most people, but there's another genetic change that together with this normally healthy change, it does cause some kind of problem. And then there's environmental factors that affect the genes. So for example, if you are exposed to certain chemicals, plastics, heavy metals, smoking during pregnancy, at certain different trimesters, it has a bigger effect on your chances that the child would have autism. During pregnancy is the most critical time. There's things that you should do before pregnancy, like taking folic acid before the pregnancy and during the first trimester. That can seriously reduce the chances for autism. And then there's a lot of factors that are really hard to control, like diabetes. Okay. A new sound. Okay, Dovey's very excited about our walk and our talk, but we're trying to continue over here. So we don't know to recognize all the genetic makeup, and some genes are theorized to only be relevant with the combination of the environmental factor. It's really difficult to get this kind of information pinpointed to allow people to make decisions about how to have children, to make sure that they don't have autism, or reduce the chances to have low function autism, and how to make treatments that are capable of counteracting these effects. so that children that are at high risk to have an autistic regression during their early childhood, even though they have like a very strong genetic disposition and all the risk factors that could not be avoided were there. So we're talking about like autism is usually related to neuroinflammation, neuronal degradation, and so we're looking into treatments that might counteract that. So we know that stem cell therapy is good against that. We also know that in autism there's a connection to the gut. Gut lining, gut microbiota balance is important. So there is treatments looking into that. All sorts of different treatments that could be counteracting some of the neural inflammation, some of the immune system irregularities, things like that. Hopefully we'll see a more precise diagnostic tool that doesn't only rely on a subjective diagnosis by a psychologist and a psychiatrist or a neurologist. And over here, too fast. And that way we'll have also, you know, that will affect our ability to give a precise treatment, right? Whether it's medicinal or biological or combination. So we'll keep you know, reading up on it, trying to help our children, and I hope we have good news in the future. Don't forget to leave your comments, to follow this page for more updates.